In this film, we are going to provide the details about diabetes and what happens if the system of glucose absorption and utilization doesn't work properly. The food we eat contains components called carbohydrates, which are further broken down in the stomach and intestine into glucose. Glucose is a form of sugar that gives us the necessary energy for our daily activities. Absorption of glucose in the gut results in a steady rise in blood glucose level. In response to this rise, an organ called pancreas adjacent to stomach starts releasing a hormone called insulin. The flowing bloodstream carries insulin and glucose to every cell of the body. On reaching the cells, insulin acts like a key in unlocking the cell to facilitate the entry of glucose. In this way, there will be normalization in blood glucose levels. In conditions of starvation, the liver can compensate by releasing further glucose from the reserves. Our body would like to keep blood glucose at optimal levels by balancing glucose and the insulin levels. In diabetes patients, this system does not work properly. There are two main forms of diabetes, type 1 and type 2. In type 1 diabetes, the pancreas can produce little or no insulin. It occurs when the body destroys its own insulin, secreting cells in response to triggers such as an infection. Children, adolescents, or young adults are usually affected by type 1 diabetes. As there is no production of insulin, the glucose cannot get into the cells, resulting in a dramatic rise in blood glucose levels. The body tries to remove excess glucose through kidneys. This is why diabetes patients urinate quite often. As glucose is filtered in the urine, these individuals lose a lot of water as well. This makes them thirsty. Excess glucose content in urine can also cause itching, increase the risk of urinary and genital infections. Healing of wounds will be a problem because the excess content of glucose in blood creates a rich medium for bacteria. Glucose can also build up in the eye lens, causing blurred vision. Patients with diabetes can also feel tired and lethargic. In these extreme conditions, the body provides energy by burning its fat reserves. This can result in weight loss. In type 2 diabetes, the body is either not producing enough insulin or the cells mainly of muscle, fat and liver fail to respond to insulin. This is known as insulin resistance. It can occur due to low physical activity, genetic factors, excess body weight, with age, or increased abdominal fat. This results in an increased blood glucose levels. Gestational diabetes occurs in pregnant women. The hormones responsible for maintaining pregnancy can prevent insulin production. Improper management may harm both the baby and the mother. As with other diseases, many myths surround diabetes. Myth: being overweight is bound to cause diabetes. The fact: while excess weight is a risk factor, it's not the only cause. Myth: diabetic patients can never eat chocolates and other sweets. Fact: with a balanced diet, diabetic patients can consume limited quantities of these items. So, how do you know that you have diabetes? Your healthcare provider will look for certain symptoms like frequent urination, excessive thirst, thrush or genital itching, slow healing, blurred vision, tiredness, and weight loss. Your doctor may also ask for different tests for blood glucose like HbA1c, fasting plasma glucose test, and postprandial plasma glucose test. HbA1c test shows you how your blood glucose has been over the last 3 months. The HbA1c goal for most people is below 7. In the FPG test, blood glucose levels are measured after an 8-hour overnight fast. The recommended target is around 70 to 130 milligrams per deciliter. In PPG test, the measurements are taken 2 hours from start of the meal. The recommended target is less than 180 milligrams per deciliter. You can also monitor your blood glucose at home by using a glucometer, a test strip, and a lancing device. In this test, a drop of blood drawn from your finger is placed on a test strip. This strip is inserted into the glucometer, which provides the results of your blood sugar level. Please remember that your testing conditions at home are different from a laboratory. Calibration will help in matching these results. Patients on insulin are recommended to monitor their glucose levels at least 4 times in a day, which includes a fasting test, test before meals, and test before going to bed. For patients on oral therapy, the frequency depends upon their blood sugar level control and their medicine regime. Patients who are on stable oral regime and whose HbA1c levels are under control need not test so often. So, once diabetes is confirmed with tests, what is the way forward? Let us look at some management options. The good news is, diet and lifestyle changes can help in keeping your blood sugar at a normal level and prevent other major complications like kidney damage and vision problems. Here are some important recommendations. Manage your diet based on your needs. Exercise every day. Monitor your glucose regularly. Take medication regularly. Do not miss the insulin dose if you are on insulin. Reduce weight if you are overweight. Take special care of your eyes, feet, and skin every day. Your healthcare provider will usually prescribe medicine to control your blood sugar on a regular basis. These medications may either help your pancreas make more insulin to lower your blood sugar or help your body in using insulin better. In cases where the body is unable to produce insulin, external insulin is provided. You have to take the medicine regularly to avoid complications like heart attack and stroke, eye problems that can lead to blindness, nerve damage that can cause your hands and feet to hurt, tingle, or feel numb, kidney problems, gum disease, and loss of teeth. Let us understand more about insulin. In diabetes patients, the body can either not produce insulin or not utilize it. Type 1 diabetes patients initiate their therapy with insulin injections. However, type 2 diabetes patients will usually initiate treatment with oral pills. Insulin therapy is given as a shot with the use of syringes, pens, or pumps. In the conventional syringe and vial system, the patient will need to manually extract the accurate dose and administer it. Insulin pens combine the syringe and vial into a single tube. One variety of pens are pre-filled with insulin, and the other type contains cartridges that can be replaced. Instead of manually extracting insulin, these pens provide the option of dialing the dose on the pen. Once dialed, the insulin is then injected through the pen's needle in a manner similar to the syringe. Insulin pumps are designed to provide 24-hour supply of insulin through a catheter placed under the skin. Insulin can be given in the subcutaneous tissues, in abdomen region or thighs or arms. Abdomen region is considered to be the best option. Insulin therapy is aimed towards maintaining HbA1c levels as close to normal as possible without causing hypoglycemia. The American Diabetes Association recommends a treatment goal of 7%. Here are some things you should know about insulin. Insulin should be ideally stored in a refrigerator when not in use. Don't inject insulin directly after removing from the fridge. Store the insulin bottle that is in current use at room temperature. Insulin should not be exposed to extreme heat or ice-cold temperature. Keep a check on the expiry date. Always check the bottle before you draw the insulin out into the syringe. Patients on insulin can enjoy any length of vacation if they have planned it well. Your medication bag should contain all the insulin and syringes needed for the trip, blood and urine testing supplies, extra batteries for the glucose meter, and other oral medications. With smart lifestyle modifications, taking prescribed medications or insulin regularly, you can transform the way you feel about diabetes and live the normal life that you have always wanted to.